Welcome to Merced County Public Health's Introduction to Blood Pressure and Self-Monitoring. So we're going to start off with an activity. We're going to start by checking our pulse rate. To check your pulse rate, take the tip of your index finger and your middle finger and gently press them to your wrist just below your thumb. You can also check your pulse rate just under your chin next to your windpipe. When you feel your pulse beating, count how many beats you feel for 15 seconds. You can use a watch or a timer to help you. Feel free to put this on pause while you do this. So, after 15 seconds, take the number you counted and multiply it by 4. This will tell you how many times your heart beats in 1 full minute. This number is your pulse rate. So, have you ever wondered where your pulse rate comes from? All right, we're going to talk about that. First, we're just going to start off with the basics. So, what is blood pressure? Blood pressure is the force or push of your blood moving against the walls of your arteries. Your arteries are the tubes that carry your blood from your heart to the rest of your body. When your heart beats, it pushes the blood through these arteries. This creates a pressure, kind of like when water is pushing through a garden hose. This also is what creates your pulse. You often see the units of measure for blood pressure as capital Hg. This just stands for millimeters of mercury, which is how we measure pressure. So, did you ever wonder what is a normal range? So, you normally see it as written 90 over 60 through 120 over 80 is about a normal range. But what do those numbers mean? The top number is the systolic, which shows how much pressure are in the arteries as your heart is beating. The bottom number is your dystolic, which shows the pressure when your heart is at resting or just between beats. Anything in the normal range means your heart is working well and the blood is flowing the way it should through your body. However, if your blood pressure gets too high, it can cause serious problems like stroke, which is when your blood flow to the brain is blocked or an artery or vein has burst. Heart attack, when the heart is just not getting enough blood or oxygen. And then, of course, kidney disease, because high blood pressure can damage your kidneys over time. So, who should be most concerned about their blood pressure? So, some people need to pay extra attention to their blood pressure because they have a higher chance of developing heart problems. These people should check their blood pressure more often and talk to a doctor if it becomes too high. So, people over 51 definitely need to have their blood pressure checked regularly. People who have high blood pressure, also called hypertension, people who have diabetes or kidney disease, and people who have a family history of heart disease. When you add all these groups together, it includes about half of the people in the United States, which is why understanding high blood pressure is so incredibly important. So, what are the top 10 things you need to know? One, high blood pressure is linked to increased risk of cognitive decline and dementia. High blood pressure is the leading risk factor for stroke and a number of different heart conditions such as coronary artery disease and heart failure. High blood pressure during pregnancy. There are different diagnoses of high blood pressure during pregnancy, and it can happen to almost anyone. But first, what is determined high blood pressure when you're pregnant? You'll see that it is actually higher than when you're not pregnant. So, high blood pressure is usually considered 140 over 90 or higher. Severe high blood pressure is when the blood pressure is 160 over 110 or higher. So, chronic hypertension is when a person already had high blood pressure before pregnancy and it continues after the baby is born. Gestational hypertension or high blood pressure is high blood pressure that starts during pregnancy in someone who used to have normal blood pressure. Preeclampsia. This happens after 20 weeks of pregnancy. The blood pressure suddenly becomes high, and there may be protein in the urine or other health problems. Eclampsia. This is extremely serious. It happens when someone with preeclampsia starts to have seizures. Doctors sometimes give low dose aspirin to people who might be at higher risk in order to prevent preeclampsia and, of course, eclampsia. So you need to know your numbers. Know that normal blood pressure is when your systolic is less than 120 and your systolic is less than 80. If your blood pressure is higher, talk to your healthcare professional about how to lower it. So if you have high blood pressure, it could become life-threatening. You need to call 911 right away if you have chest pain, shortness of breath, back pain, numbness, weakness, a change in vision, or difficulty speaking, or a combination of those symptoms. So anyone can develop high blood pressure. People are encouraged to have their blood pressure checked regularly. This includes people of all ages, including children, young adults, and of course, older adults. To get your blood pressure reading, you should sit in a chair, support your back. Both feet should be flat on the ground, arm extended and supported at about heart level, and stay quiet and still. In addition to lifestyle changes, if you have high blood pressure, you may need medication. So it is incredibly important to eat a healthy diet to lower or prevent high blood pressure. Some key nutrition information to know: sodium. Adults, normal adults should have less than 2,300 milligrams per day. This is 1 teaspoon of sodium or less, moving towards the ideal limit of 15,000 milligrams or about 2/3 teaspoons of salt a day. Follow a heart healthy eating pattern, for example, the DASH eating plan, which emphasizes reducing sodium intake and a high diet in vegetables, fruit, whole grains, legumes, nuts, seeds, low fat protein, low fat dairy, and includes cooking with non tropical vegetable oil. Fruits and vegetables are very important in this diet. Eat plenty of fruits and vegetables and eat a variety so you get more nutrients. Alcohol. Drink less or drink no alcohol in order to prevent high blood pressure. So, and then for those living with excess body weight, learning or losing about 5% of your body weight can support your overall health and help lower or prevent blood pressure. As an example, someone that weighs 180 pounds, if they reduce by 5%, they're lowering their body weight by 9 pounds. And this can also help lower your blood pressure. So check out Life's Essential 8 to learn more about what you can do to improve your health, your heart, and your brain health. So it also helps you manage your blood pressure. So eat smart with a DASH style diet, DASH style eating pattern. Stay active in your way. This could be anything. If you like to walk, if you like to run, swim, whatever, just stay active. Reduce or eliminate alcohol. Try stress reducing activities, including meditation, breathing control, yoga, or whatever works for you. Get 7 to 10 hours of sleep per day. Manage your weight. Control your cholesterol. Manage your blood sugar. It's also important to ask your healthcare professionals about other common health conditions that can lead to high blood pressure. which could include conditions such as being overweight, sleep apnea, diabetes, and thyroid problems. So, we're going to talk a little bit more about the DASH diet because it's a simple way to stay healthy. So, the DASH diet is recommended by both nutritionists and doctors because it helps lower high blood pressure. It focuses on eating more fruits and vegetables, whole grains, low fat dairy, and low fat proteins. It also encourages eating less salt, sugary foods, and fatty meats. The DASH diet helps you keep your heart strong and body healthy. How does the food play into all this? Some principles to follow. Aim to eat lots of vegetables. Try to make half your plate non-starchy vegetables such as leafy greens, cauliflower, cucumbers, snow peas, cabbage, mushrooms, or many more. Whatever vegetables that you like. Vegetables are very nutritious and include fiber and are also low in calories. Fiber also helps you manage your blood sugars. Okay, so you're also going to try to make a quarter of your plate a lean protein, such as fish, chicken, lean cuts of beef or pork, eggs, legumes, for example, lentils, chickpeas, kidney beans, pinto beans. Then the last quarter of your plate is for your whole grains and starches. This could include rice, potatoes, pasta, cereal, bread, and grains such as oats, quinoa, or barley. Select plant oils such as olive and canola or nuts instead of animal-based fats and coconut oil. Add low-fat milk or yogurt and a piece of fruit to complete out your meal if you like. Calories should also be balanced as in versus out. So what you're taking in through food should be going out in exercise or regular activity. Most important for those with high blood pressure is to reduce sodium, reduce saturated and trans fats, and reduce sugars, added sugar. Sodium, saturated and trans fats, and sugars all increase blood pressure. So we're going to start with the most important first. So sodium, which is also salt. Excess sodium intake causes your body to retain fluid and can be hard on your heart. It makes blood pressure management much more difficult. So remember I said that for the general population, it's 2,000, well, about 1 teaspoon of salt per day. For those with high blood pressure, you need to reduce that and have less than 2/3 teaspoon per day. Most Americans consume much more than this every day, with the average being 3,400 milligrams of sodium per day, which is 32% more than the recommended daily allowance for general population, and is 56% more for those with high blood pressure. So how do we limit our sodium intake? Most importantly is to read the nutrition labels. Choose foods less than 5% of the daily value for sodium. Remember to always check your serving size, which is circled here in blue. In this example, the label to the right has a serving size of 8 ounces, which is 1 cup, and the label on the left has a serving size of almost 11 ounces, which is about 1¼ cups. Notice the smaller serving size also has more sodium. The amount of sodium in a food is listed in milligrams and is a percent, and also as a percent of daily value on the nutrition label. The percent daily value for sodium gives a general idea of how much sodium a serving adds to your total daily diet. The percent daily value for sodium on the nutrition label shown here is based on the daily maximum for the general population, which again is over 2,000 milligrams. Remember that if you have high blood pressure, you need to have even less because your maximum is 1,500 milligrams. So, even this low sodium the circle in red option is not a good option for someone with high blood pressure. Eat more servings of fruits and vegetables every day. A diet rich in fresh and frozen fruits and vegetables can actually help lower your blood pressure. Limit your salty foods. Okay, the easiest and best way to limit intake is to follow your DASH eating plan. Eat more fruits and vegetables. Fresh, frozen, no salt added. You always have to check and make sure that it says no salt added canned vegetables. Use fresh poultry, lean meat, and fish instead of processed meats and cheeses. Limit salsas. Limit ready-made mixes and instant products. All of those are high in sodium. Use different spices to add flavor to your food. Ask for no salt when dining out. Read your nutrition labels to compare sodium levels and choose options that are the lowest in sodium. So, why reduce sodium? Eating less sodium or salt is important for keeping your body healthy. When you lower how much sodium you eat, you help your heart and the rest of your body work better. It helps build your healthy habits. Eating less sodium helps you make good food choices. It helps you stay healthy as you grow. It can help prevent long-term health problems in the future. So, it also helps reduce fluid buildup. Too much sodium makes the body hold on to extra water. This causes weight gain from water that your body doesn't need, swelling or bloating, and higher blood pressure. It helps you feel better overall. When you lower your sodium, you have less bloating. It can be easier to keep your weight under control and helps your heart work better. It makes managing your blood pressure so much easier. Fats and oils. What are fats and why are they important? Dietary fats are essential. Fats give your body energy and support cell growth. Fats protect your organs and keep your body warm. Fats also help your body absorb nutrients and produce important hormones. So there are four different types of fats: trans fats, saturated fats, monounsaturated fats, and polyunsaturated fats. For the most part, intake of fats is fine, except for trans fats. You don't want trans fats. Most foods contain a mix of all the different fats, including each fat comes from helps make you make better food choices. We're going to take some time and go through each fat, the pros and the cons, and help you make more informed choices. Starting with the worst, what are trans fats? Trans fats are a type of fat that is not healthy for your body. These you need to stay away from. Some trans fats happen naturally in small amounts in meat and dairy, but most trans fats are made by factories when they turn liquid oils into solid fats. These are called partially hydrogenated oils. Trans fats are often found in donuts, pastries, fried foods, margarine, baked goods like cookies and cakes. These fats help foods last longer and taste crispier, but they are bad for your heart. So, health risks of trans fats. So the cons, the not goods. They raise your bad cholesterol, your LDL. They lower your good cholesterol, HDL. They make heart attacks and stroke more likely. They cause inflammation in the body. They make it harder for your body to use insulin. They increase the risk of obesity and other health problems. More than 200,000 people around the world die each year because of industrial trans fats. Even natural trans fats in meats and dairies should only be eaten in small amounts. So, where do trans fats come from? So, like we said before, they're factory made. They're the most harmful. They're found in fried foods, fast foods, packaged snacks, margarines, and baked goods. Many from partially hydrogenated oils. Natural trans fats are found in small amounts in meats and dairy from cows, sheep, and goats. These are less harmful but should be not eaten very often. Recommendation rules. Health experts say you should eat less than 1% of your daily calories from trans fats. That is about 2.2 grams per day for someone eating a 2,000 calorie diet. And most of us shouldn't be eating a 2,000 calorie diet. And many countries have banned trans fats in food. The United States banned partially hydrogenated oils in 2018, and all food companies had to stop using them by 2020. The World Health Organization wants to remove trans fats everywhere in the world. So, how to eat less trans fats? Pros: good choices. Making those good choices. Look for foods made with healthy oils such as olive, canola, or sunflower or safflower oil. Choose fresh foods instead of packaged or fried foods. Avoid or limit foods that say partially hydrogenated oil or shortening on the label. Fried foods, baked goods, and processed snacks, high fat dairy or red meat, which also have small amounts of trans fats. Bottom line, if you avoid foods with artificial trans fats and only eat natural trans fats, sometimes you can protect your heart and keep your body healthier. Hmm. So, next we have saturated fats, also known as fatty acids. These you may have to reduce as directed by your doctor, or you may not need to change your diet to include the saturated fats your body requires. So, saturated fats are broken down into different fatty acids by the length of their carbon chain. Long chain fatty acids, palmatic oil acids. Pros: so these help your cells work and grow. It gives your body energy. Cons: they can raise the bad cholesterol, which is the LDL, which can hurt your heart. They're often found in processed foods, which can be unhealthy when eaten too much. So these are found in palm oil, animal fat, dairy, coconut oil, and olive oil. Stearic acid. Pros: it does not raise your cholesterol. It helps calm your body, so it's anti inflammatory. Cons: they do have a lot of calories, which can lead to weight gain if eaten in large amounts. So these oils are found in beef, cocoa butter, and are used to make chocolate. Myristic acid. Pros: gives your body energy, helps build cell membranes, the walls of your cells. Cons: raises your bad cholesterol, can increase inflammation if eaten too often. This is found in coconut oil, palm kernel oil, and dairy foods. Okay, moving on to medium chain fatty acids. Lauric acid. Pros: helps keep your gut or your stomach and intestines healthy, supports your immune system so you don't get sick as easily, gives your brain quick energy, raises your good cholesterol, your HDL. Cons: in supplement form, it may raise bad cholesterol as well, and it is found in coconut oil. So, capricic acid. Pros: helps keep your gut healthy, supports your immune system, gives fast, easy energy, easy for most people to digest. However, it's not recommended for people with liver problems because the liver breaks it down. It's found in goat's milk and MCT oil. Short chain fatty acids, acid, feeds cells in your colon or your large intestine, keeps your gut wall strong, helps reduce inflammation, very important in healthy digestion. Cons: not found in many foods, so it can be harder to get. Naturally found in butter. Okay, so now we're going to move on to our good fats, our monounsaturated fats. So, monounsaturated fats, what are they? Monounsaturated fats are considered healthy fats. They have special shape in which one bend in their chain, and they're mostly found in plants like olives, nuts, avocados, but also can be found in animal foods. These fats are good for your body and can help your heart stay healthy. So, the pros, the health benefits. They lower bad cholesterol, again, LDL. They raise your good cholesterol, your HDL. They help protect your heart and reduce the chance of heart disease and stroke. They make it easier for your body to use insulin. They help lower inflammation. They give your body energy, and they support your good mood and help you stay active. People who eat diets rich in monounsaturated fats, like the Mediterranean diet, often have healthier hearts. Possible cons. While these fats are healthy, still eating too much of any fat can add too many calories. You should still balance your monounsaturated fats with other healthy foods. So, where do these monounsaturated fats come from? What are those food sources? So, of course, you often hear about olive oil, avocado oil, canola oil, hyaluronic sunflower oil, macadamia nut oil, and they also come from nuts and seeds such as almonds, peanuts, cashews, macadamia nuts. They come in some fruit like avocados and olives. Yes, those are fruit, as well as animal foods such as red meat, whole milk, beef fat. Now, remember, we're balancing here too. Even though we say they come from red meat, whole milk, and beef fat, if you do have high cholesterol or high blood pressure, you do want to limit these. Other sources are algae oil, which is very high in monounsaturated fats. So, how much should you eat? Monounsaturated fats are a good choice, but still should be eaten in moderation. Experts recommend replacing unhealthy fats like saturated and trans with monounsaturated fats. The American Heart Association recommends keeping unsaturated fats low, choosing more unsaturated fats. So, just a quick summary, monounsaturated fats are an important part of a healthy diet. They help your heart support your body's energy, reduce inflammation, and may even help your mood. Eating foods like olive oil, avocados, nuts, and certain plant oils can help you stay healthy. Now, for the fats you should eat more of. These are the polyunsaturated fatty acids. So, what are polyunsaturated fatty acids? They are healthy fats that your body needs, but your body cannot make them on its own. This means you need to get them through the foods that you eat. These fats help your body grow, stay healthy, and work properly. So, the health benefits are the pros. So, polyunsaturated fats help your body lower the bad cholesterol, reduce the chance of heart disease and stroke, support brain growth and learning, build and protect the cells of your body. These fats are an important part of staying healthy. So, how much should you eat? The American Heart Association suggests eating about 8 ounces of seafood each week. So, just remember about 3 ounces is the size of a deck of cards. Using up to 3 tablespoons of healthy vegetable oils each day. These oils give your body energy and and are an important nutrient. Where do these polyunsaturated fats come from? You can find them in walnuts, flax seeds, sunflower seeds, fatty fish like salmon, plant oils like olive oil and canola oil. These fats are usually liquid at room temperature and get thicker as they get cold. So, why polyunsaturated fats matter? Polyunsaturated fats are a key part of a balanced diet. They give your body nutrients it needs and help keep your heart and brain healthy. To make smart choices, check your food labels for monounsaturated and polyunsaturated fats so you know you're picking healthier options. All right, now we're moving on to sweeteners and added sugar versus natural sugar. So, what is natural sugar? Natural sugar is the kind of sugar that is already inside your whole food. So, you'll find natural sugars in fruits and vegetables, milk, and dairy products. Some examples include fructose in fruit and lactose in milk. These foods also give you fiber, vitamins, minerals, and antioxidants, which helps slow down how fast your body uses the sugar. This gives you a steady energy and helps you feel full longer. What is added sugar? Added sugar is the sugar that is put into the food when it's being made, cooked, or served. This type of sugar does not come naturally from the food itself. Health impacts. Natural sugar pros. Gives steady, long-lasting energy, helps keep blood sugar more stable, comes with healthy nutrients that help your body, supports your overall good nutrition. So, and then added sugar, what are the cons? Eating too much added sugar can cause spikes and crashes in your blood sugar. It can make you get hungry sooner, increases your weight gain, leads to insulin resistance and type 2 diabetes. It can raise the risk of heart disease, causes inflammation in your body, can lead to liver problems. Health experts say added sugar should be less than 10% of your daily calories. So, we're going to talk about labels again. Why label reading matters. It's important to read your food labels carefully so you know how much sugar is in your food. On the nutrition facts label, you will see total sugars. That's all the sugars in the food, highlighted on the label on this slide. Added sugars, the extra sugar put in during cooking or processing, you should also check that ingredient list for the hidden sugars like syrups, juice, or concentrate. What are added sugars? Added sugars are not natural to the food, and this is highlighted in both the labels. They are sugars that are added when the food is made, cooked, or packaged. Added sugars give you energy, but they do not give your body vitamins, minerals, or fiber. Common types of added sugars can have many different names. Here are just some that you might see on a label. Sucrose, which is basically just table sugar. High fructose corn syrup, honey. Even though we think of honey as healthy, it is still an added sugar. Agave nectar, maple syrup, brown sugar, dextrose, fructose, glucose, maltose, molasses, raw sugar, cane sugar, fruit juice concentrates. That's just another form of adding sugar. So there is an OSE rule, OSE. If a word ends in OSE, such as fructose or glucose, it is usually a type of sugar. So, just a tip. Ingredients are listed in order from most to least. So, what's the ingredient that's in the highest percentage is listed first. If sugar or syrup is near the top, the food has a lot of added sugar. Natural sugars come with fiber, vitamins, and minerals, which help your body use them slowly and safely. Added sugars are sometimes hidden and can easily lead to eating too much. So just to understand a nutrition label, the total sugars, this number includes both added and natural sugars. On this label, notice that the label to the right has 17 grams of added sugar, which is about 1.4 teaspoons, and on the left is 0. Also notice the serving size is 1 tablespoon, a single is 1 tablespoon. And remember that a single tablespoon is about 3 teaspoons. This product is much more than half added sugar. The number tells you how much sugar was added during processing. Daily value. Health experts say added sugars should be less than 10% of the calories you eat each day, about 50 grams for a 2,000 calorie diet. And again, none of us are probably should be eating a 2,000 calorie diet. Why knowing about added sugar is important. Eating too much added sugar can add too many calories, increase the risk of health problems, make you hungry sooner, cause blood sugar spikes and crashes. Many packaged foods have hidden sugars, so read your labels carefully, and this will help you make better, healthier choices. So, just a quick health tip: choose whole foods like fruit, vegetables, and dairy. They have natural sugars, plus they have those extra nutrients that you need. Limit processed foods like sugary drinks, desserts, and snacks. Eat added sugar in moderation. A little is okay, but too much can harm your health. So, discussion. We're just going to think about what snacks you are your favorite. What are your favorite snack foods? Put the video on pause while you think over your favorite snack foods. Restart when you're ready. Great. So, what are your favorite snack foods? Is it an apple or is it a Pop Tart? What what are the pros and cons of each? Most of our added sodium and fats and sugars come from snacks and processed foods. It's important to substitute unhealthy processed foods with healthier options, but sometimes this can be really hard. Choosing healthy snacks is like being a label detective. You look closely at the foods and make sure to give your body good energy, not just sugar or empty calories. So here's a few helpful hints when you're choosing your snack foods. Use the pair rule. This is protein plus fiber. Try to eat just Try not to eat carbohydrates by themselves, like a plain cracker or just an apple. These foods can make your blood sugar go up fast and then drop. Then it'll leave you hungry again. Instead, pair a carb with a protein or a healthy fat. So, for an apple, eat an apple plus almond or peanut butter. It's really good when you dip them. Berries with Greek yogurt, carrots, and hummus. Why this works. Protein and fiber help your body digest your food more slowly, and so you will stay full longer and have steady energy. So, 2, check the first 3 ingredients. The ingredients are listed by how much is in the food. The first 3 ingredients are the most important. Avoid snacks where sugar, syrup, white flour are in the top 3. Choose snacks that start off with whole grains, nuts, or seeds. Here on the top of the slide, you see the first 3 ingredients are corn flour, sugar, molasses. So we have 2 sugars in the first main ingredients. So number 3, use the handy portion guide. Eating from a big bag of chips or can make you eat too much without noticing. Instead, use your hand to measure. So for nuts or seeds, one small handful is about your palm is a serving size. For nut butter, the serving size is your thumb. For fresh fruit, about the size of your fist is just as a proper serving size. So number 4, watch for those tricky healthy words that sometimes food boxes make things sound healthier than they really are. So be careful with labels that say fat free. It often means more sugar. Gluten free does not mean it's healthier. Multigrain might still be made with refined grains. Look for 100% whole grain instead. Okay, so discussion. What do you like to eat? Fast food places? What are your favorite fast food places or restaurants? Eating out can be extremely tricky when you're trying to eat healthy. Feel free to put the video on pause and restart after you've thought about the places that you really like to eat. So, some tips that are for eating out. You really need to understand the menu. Look for words like steamed, broiled, baked, grilled, poached, or roasted. Always, you can ask your server for what are the healthier options. Check the menu for items marked healthy. Choose entrees that feature seafood, chicken, or lean meat. Get your salad dressing and sauces on the side so you can control the amount that you're putting on your food. These a few different choices can make all the difference when you're eating out. Physical activity and blood pressure management. So moderate physical activity has been proven to decrease blood pressure and hypertension. Patients who are less responsive, especially in patients who are less responsive to medical treatment. 30 minutes of physical activity a day, the equivalent of brisk walking, 6 to 7 days a week, which is equal about 180 minutes each week, may result in better management or a reduction in one's blood pressure. So it is very important to seek regular health care if you have high blood pressure. If you need assistance with health coverage, the Merced County Human Services Agency can help residents obtain Medi-Cal and covered California insurance. This includes access to low-cost dental care as well. If you need health care, Merced County Public Health has programs to get immunizations, HIV care programs, and TB care. Golden Valley Health Centers offer extensive services, including family medicine, dental care, behavioral health, urgent care, and maternity care. They have clinics all over Merced County. All insurances are accepted, and if you are uninsured, they do have a sliding fee scale based on your income. If you need mental health services or would like more information on additional resources, please call 209 381 6800. Thank you for joining us for our Intro to Blood Pressure Management. Please take a look at our other online learning classes and have a great day. Thank you.